Robert F. Kennedy Jr. faced his first Senate confirmation hearing as President Donald Trump's nominee to become the next Secretary of Health and Human Services. He was grilled about his views on vaccines and abortion, as well as potential conflicts of interest that he would face in the role. Capitol Hill correspondent Erik Rosales reports. Erik.
Well, good evening, Tracy. Well, several of Trump's cabinet picks have generated controversy. None have generated more than that is of Kennedy. He has drawn a number of controversy. He has been the subject of negative political ads, along with just this week, his own cousin Caroline Kennedy wrote a scathing letter asking the Senate to deny his confirmation, describing him as a predator. Well, today, Kennedy started off his testimony with how he would make the country healthy again and deal with childhood obesity.
School lunch programs could be a driver for helping kids. We shouldn't be giving 60% of the kids in school processed food that is making them sick. We shouldn't be spending 10% of the SNAP program on sugared drinks.
Democrats were quick to turn their focus to Kennedy's previous statements about vaccines.
It's time to make sure that we blow the whistle on actually what your views are. At least we're starting.
We need to move
Senator,
on.
I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those vaccines.
Questions then shifted to how he would handle Medicare, Medicaid, private insurances, and mental health.
I was a heroin addict for 14 years. I've been 42 years in recovery. I go to 12-step meetings every day, so I hear the stories every day. And I hear the many stories about denial of, or the barriers to access to care. And we need to improve that. I think things that we can be doing, including cooperatives, which President Trump has supported, including health savings accounts, which President Trump has supported. All of these things to make people more accountable for their own health.
The abortion issue then took center stage in how he would enact President Trump's pro-life policies.
Every abortion is a tragedy. I agree with them that we cannot be a moral nation if we have 1.2 million abortions a year. I agree with them that the states should control abortion. President Trump has told me that he wants to end late-term abortions, and he wants to protect conscience exemptions, and that he wants to end federal funding for abortions here or abroad.
Pro-life Senator James Lankford also asked about FDA failing to present the side effects of the chemical abortion pill mifepristone. Democrats countered with numerous studies claiming the abortion pill is safe.
Mifepristone is safe. The only reason it's under question in 2025 is because people with a political agenda have been out lying about it. Women deserve to know if Mr. Kennedy will abuse his power as our country's chief health officer to essentially implement a national abortion ban.
After the hearing, pro-life organizations fired back, saying that the abortion pill is not safe. The American Association of OBGYNs actually made a statement on X that potential deadly complications could take place, such as hemorrhage and sepsis. They also said that they stressed the need for medical supervision. By the way, Kennedy's confirmation hearing continues tomorrow. He will appear before the Senate Health Committee. He can afford to lose only 3 Republican votes when the Senate actually gathers in full. I also want to let you know about someone else's fate. Former New Jersey Senator Bob Menendez was sentenced to 11 years in prison. He was found guilty of bribery, fraud, and a variety of other charges. He was once the chair of the powerful Senate Foreign Relations Committee. You may recall that the FBI ended up finding 13 gold bars and nearly $500,000 in cash inside his home.